Hi, and welcome to this episode of Rapid Rounds. Okay, Rapid Rounds. So this is a 100% case-based discussion where we will work through a case together, and there's going to be choices, and there will be multiple choices.
But we rely on those guys,
yes,
right, to give us the answer. Perfect. All
well,
right,
not
I'm
to
ready.
give us the
What?
answer.
You said
no.
100%. Okay, fine.
But we do want you to work through the case along with us, and if you have friends with you, hit that pause button and discuss what you would do, especially if it's something different from what they would do or from what we let you know that we would do, because that's the whole point of it. The answers are not always the same.
What?
Yeah, not everybody has the same answer.
No,
So
it's not. That's not
I know. So let's get into it. Shall we get into it, folks?
I'm ready.
Okay.
Do you have the case?
I do have the case.
Okay, thank goodness, because I didn't have a case. All right.
No, Dr. Jason never brings a case.
Yes, I don't.
Okay. So today's case is a 9-year-old male chocolate lab.
Chocolate lab?
Mm-hmm.
Okay.
And he presents to his regular veterinarian with his owner. And the owners are there because they think he may not feel well because for the last few weeks, well, he's been a little bit less active. Yeah. Okay.
I'm less active.
But you're not a 9-year-old lab.
I'm not a 9-year-old lab. Okay.
Yeah. So what's happening? What are you going to do?
That's all I got?
I mean, you walk in the exam room. That's why they're there.
Okay. All right. What am I going to do? Or what are they going to do? What am I going to do?
What are you going to do first?
Oh, physical exam. Get
Oh,
a
a
history.
physical
Come
exam,
on.
of course.
That's like the answer for everything. Physical exam. Have a look at the dog. Put your hands on the dog. Get a weight. Get a history. Find out what's going on.
Okay,
Look at the
so
record. All that stuff.
So you guys want some results from a physical?
I would like some results.
Okay,
from
perfect. So we'll start with that. It's a baby step, right? No choice there. Everyone ought to do a physical right off the bat. So, so he is 110 pounds, chocolate lab, neutered male. He's got, a little bit of dental calculus. His gums, mucous membranes are pink.
Okay.
Little sticky, but he's trying to lick you while you're doing the exam.
Chocolate lab? No way. All right.
Normal temperature.
Oh, good.
Difficult to sculpt the chest because guess what? He's panting.
Yeah.
And the abdomen's a little bit difficult to palpate because
It's round.
Yeah.
Okay, because round. It's round. All right.
he is round.
Okay.
He's round.
Okay.
All right.
That's what we got.
Now what are you gonna do?
So, well, I'm gonna I'm gonna go recheck the weight, make sure that's right.
Oh, you think that's heavy?
I think he's a bit overweight.
Okay.
I do. Yeah.
So might you look for a body condition score?
I mean, overweight's not a body condition score?
No.
Oh, okay, all right. Yes.
We assign a number.
We would assign a body condition score. That's like, what is that? Like 0 to 35, or what is a body condition score?
Well, it can be 0 to I think 10.
Okay.
Yeah, I think anything over 5 is large.
Okay.
This guy would be like an 11.
I was gonna say, what is the body condition score?
Yeah.
So what do you think it is? You have the case.
Yeah, so it's like a 9.
Okay, you said 11. You were kidding. A 9. A 9 out of 10 for a body condition score, which is almost obese, if not obese.
It's obese. We haven't seen those ribs in years.
I just trying to be nice.
Yeah.
All right. Okay.
What are you gonna do next?
I don't know.
Wait.
I don't know what I'm gonna do next.
You don't know?
No, I don't. I need that.
I have an idea.
Oh, you do?
You don't have any idea?
Yeah, of course I have an idea.
But what's most important is, what
do
are
you
you
guys
going to
think?
do? So take a minute, examine these choices, press pause if you need a little more time to chat about it, and we'll see you on the other side. Okay, so what would you do?
Well, there's a couple things.
Okay.
Looking at this dog, we have not a great body condition. Okay, a terrible body condition score, let's be honest. Dog's probably not getting a lot of exercise, which contributes to that as well.
Oh.
All of us together.
Did you want more history on that?
I just assumed. Should I get more history?
Never assume.
Oh, I know what it does. Okay, we'll get more history on that. You got
Yeah.
one? Do you have more history?
I
on
do.
that? Okay, what is it?
Well, the
Why are you
owners,
holding it back?
the owners think that the dog has gained significant weight because their kids grew up and left and went to college, and their son used to walk the dog, 2 or 3 times a week.
And that's not happening. The owners aren't walking the dog as much. They're busy with work.
Their perception is that the dog is not near as active.
So life has changed, right? And so when life changed for the family, life changed for the dog. And it's part of the sequela of that could be less activity. Less activity, a little more weight gain, because I'm going to guarantee the food intake didn't change much, right?
Yeah.
All right.
Yeah. Do you get fat eating air?
What?
Do you get fat if you're eating air?
I don't think so.
No. He must be eating too much.
Oh, I was like, what are you talking about? I get it.
Yeah.
So eating too much, coupled with less exercise, things happen. So, remind me again how old the dog was?
9.
9, considered geriatric. In a geriatric age frame or not?
Yeah,
I
I would
think
say
so.
he's a
Absolutely.
senior dog. But I will remind you of what our dad says, which is old age is not a disease.
Yes, I bet he says that.
It is just a complicating factor.
It's not longer till I say that, all right? So anyway, so old dog, overweight.
What are you going to do?
I think I'm going to highly recommend blood work, ready grass.
Okay, why? What are you doing? I don't disagree. That's what I would do too.
I mean, you sure sound like, why are you going to do that? So blood work, obviously, geriatric, we kind of want to see where everything stands. You just need to see what's happening in the dog and the kidneys and liver and all kinds of stuff, right?
I'm concerned, yeah.
Yep,
Kidneys
could
and
be
liver.
a lot of stuff, right?
Kidneys and liver.
And then you want to get some good images just to see where we're at, obviously, with joints and things of that nature. But it's about that time to just get a good kind of thorough workup to see where the dog stands so we can kind of go from there.
Yeah,
Okay?
yeah. I'm also a little concerned. I would throw a thyroid test in there because
Yeah, I would agree. Sorry.
He's put on weight.
Be typically with the geriatric profile, maybe a thyroid.
You're correct. I stand corrected.
Sorry. No, I mean it's different for every practice. Make sure that's included. Absolutely. So
in the geriatric blood work would be CBC, chemistry, thyroid. He's up to date on heartworm and vaccines. That's not an issue. Okay.
Yeah.
All right. Good. So we get the X-rays, we get the blood work, and we find out.
Oh, they went for it. Good stuff.
Did I recommend it?
Okay then.
Right? Of course they went for it. And they're good owners.
Yep.
And so, and the dog is 9 and he's slowing down. Yeah. Except the eating. His appetite is good. So, so with this dog, the blood work comes back and the liver enzymes are slightly elevated. Yeah. The ALK phos is maybe 50% above normal.
Okay.
And CBC is totally fine. They're all within normal limits. And on the X-rays, you see a little bit of arthritic change.
What does that mean?
Especially in the hips.
Okay. Oh. Yeah. Well, let's be honest. I don't think anyone. Raise your hand if you're shocked with that.
How can you get to be 9 years old as a lab and not have some arthritis?
Yeah, just run around being crazy.
Yeah.
But guess what? I think all that weight, lack of running, all that stuff is starting to catch up to them.
Yeah. So a good friend told us here in the Candyverse that you got to keep the joints moving, right? You got to keep them lubed.
Yeah, got to keep them lubed. Yeah.
Yeah. So that decrease in activity probably is not helping. I don't think it's helping. I don't think that's the contribution that's making him so fat. But
right. Well, it's not. I mean, it's probably both, right?
Yeah.
So it's a sequela and a contributing factor. Anyways, it doesn't matter. It's there. He's overweight, not moving, joints are bad.
So now what are we gonna do?
Well, we talk about a plan.
I know what's. Are you ready for a plan? What's in your plan?
Well, I mean.
Do you got an idea what's in your plan?
I have an idea what could be in my plan. Yeah. What about you?
Oh, I definitely have a plan.
You always have a plan.
I always have a plan.
Again, is it really important what we do?
It's not.
Of course it is, but we kind of want to know
what would you do? So take a moment and check out these choices. Okay, so hopefully you guys saw your plan on the screen.
Yeah.
And if not, hopefully you discussed at least with yourself, this is what I'm going to do.
Right.
But tell me what your plan is at this point, Jason.
I had a plan, and then I remembered the liver enzymes.
What does that have to do with your plan?
Well, okay, my plan was, hey, listen, we're going to talk about diet, going to talk about exercise, but we're also going to talk about 9-year-old dog. We just need to feel better. Talk about some sort of non-steroidal, way to
anti-inflammatory.
Anti-inflammatory to kind of get them more active, just kind of have a better quality of life situation. But then you threw the liver enzymes in there, so
I didn't throw them in there.
Well, you told me it's part of the history. I get it. So I think maybe it's time.
Is it time?
It's time.
You don't know what I would want to do.
I'm so sorry. I always want to know what you would want to do.
Yeah. Well, I'm with you.
Okay.
Like,
Thanks.
I would say like we didn't ask. I would say a non-steroidal.
Right.
I want to do something to offer this dog some relief because I'm going to say he needs to exercise more. I think that'll help his attitude and his outlook and his disposition. Also gives him something to do besides eat, right? And the other thing I would do is probably start him on a nutraceutical supplement to help with kind of retarding the progress of joint disease.
Right.
Now, as far as which one, as far as exactly how I'm going to go about that, especially as you say with the liver already impacted, and how bold can I be, and what do I really need to be concerned about? Because while we may look at joint disease and generalized arthritis on a routine basis, this is a 9-year-old dog. He's large. And there are people who look at x-rays and see joint disease and treat joint disease all the time. Yep. And so I think at this point, since I'm in the Candyverse and I can do it, I'm going to get a stat chat. So a stat chat in Rapid Rounds is where we go to an expert to get a little bit of guidance on what we're going to do with a case. So I guess let's get a stat chat.
Let's get to it.
Stat chat.
I'm Philippa Pavia, a board-certified veterinary surgeon. Thank you so much, Dr. Jen and Dr. Jason, for pulling me into this stat chat. We can talk a lot about osteoarthritis. So, even when a dog like this, a 9-year-old, large breed, Labrador, overweight dog with a hind limb lameness comes in and screams arthritis to you, we still have to be systematic in our approach. Can't miss the forest for the trees. Still have to think about everything step by step. History, clinical presentation, progression of signs, that can be really important. Any response to therapy that the dog's already had. Then, of course, your physical exam, your gait evaluation, and then, and only then, are you going to start thinking about diagnostic tests like blood work or radiographs. All right, I've got my history, I've got my signs and my progression, and I've done my physical exam, and this dog indeed is limping on one of his back legs. His right hind limb, for example. But I still want to make sure that I'm ruling out any non-orthopedic cause of lameness. That could be neurological disease. So, large breed, older dog, lumbosacral disease, or other intervertebral disc disease. Any sort of cancer or neoplasia, gotta have it on your rule-out list. Or how about another systemic disease, abdominal pain, some other reason why he may not be walking normally. Once I've gotten through that, then I can focus on where in the limb is this pain coming from. I personally like to start from bottom to top. I like to start with the toes, the long bones, the ankle, make sure that we're not missing any of those less common sites of joint pain. Then the knee or the stifle and the hip joint, those are definitely going to be our most common sources of lameness in this dog breed. So now I've ruled out other causes of this lameness. No neurological or other systemic disease that I can think of. Ideally, if a dog's already come to me from a primary vet, maybe they've already had blood work and I know that their liver and kidney values and all other blood work is normal. That would be great. Doesn't always happen. Sometimes I'll do that myself before I move to the next step. On my physical exam, I'll want to also be systematic and go joint by joint, making sure that there's no instability or any other reason for this dog's lameness. So I've localized the dog's pain. It's his hip that's hurting. I know that his knee isn't unstable, he doesn't have an ACL tear or something else that may be a surgical illness, but he's got pain in his hip. Now I can start thinking about confirming the source of that pain, and I might want to take my x-rays now. I've got my x-rays back, and now I know this dog has hip arthritis. Most likely, both of his hips aren't normal on my x-rays, but he's only limping on his right hind leg. That's pretty common for a dog to have arthritis in both joints, but really only be limping on one. One thing we need to think about is that arthritis isn't just a static disease. There's often a baseline level of inflammation, and then something happens. Sometimes we know what it is and sometimes we don't. That raises that level of inflammation and it flares up. So that hip, the right hip, is the one that's hurting, even though they might not be normal on either side. So what do we do about it? We have our confirmation, we know that we don't need to do surgery, which is a good thing in most people's book, even if it isn't in mine. So next step, we're going to think about medical therapy, and we're also going to think about physical therapy. Things that we can do. We know this dog is overweight. There's some pretty good studies suggesting that weight loss is one of the best ways to slow the progression of arthritis. So we'll have to have that tough talk with the owner about weight loss. Other things that we can do in the short term would be an anti-inflammatory medication. I say short term because we don't want our pets or our clients' pets to be on these medications for the long term because they can have a negative effect on the internal organs if there's an underlying disease process. Other medications that we could use, things like gabapentin or amantadine. These are pretty safe medications that can be used for chronic joint pain like osteoarthritis. Other things that we definitely want to reach for would be supplements. Every dog is different. Some dogs respond really dramatically to supplements, and other dogs, it's just a really nice basis to support their joint health. Elements of these supplements can be anywhere from your basic glucosamine and chondroitin to extract of green-lipped mussels, other types of nutraceuticals. There's a whole world out there of nutraceuticals that you can look into. Then there's other things that are a little bit outside the box, like platelet-rich plasma injections, or even stem cell therapy is coming to the forefront in veterinary care as well. Maybe not something that you'll be reaching to in the first step, but things you can definitely talk about with the owner. Okay, I just gave you a whole list of things you could do, but what would I do with this case? A bunch of things. First steps and then long-term care and management. First thing, exercise restriction and an NSAID. I usually do that for about 2 weeks. That's because I want to take that inflammation, that arthritis. What is arthritis? It's just inflammation in the joint. I want to take that inflammation from here to here. I can't bring it back down to normal, but this dog's been walking around with arthritis for a while and he's been tolerating it until this most recent flare-up. So rest in an anti-inflammatory, usually for 2 weeks. If I think this dog's arthritis is bad enough, I might even start them on a long-term therapy like gabapentin or amantadine while I'm doing this initial therapy to have something to keep them steady and to keep them feeling better even when we have to wean those anti-inflammatories off. Then I'm going to calculate their ideal caloric requirement. I'm going to recommend that they bring that caloric intake down and get the dog to a healthier weight. If they can, and if you're in an area that has access to physical therapy and there are board-certified canine rehabilitation therapists, I'll sometimes recommend that these guys do see a physical therapist because they can help with weight loss, they can help with mobility, and they can help with maintaining that muscle strength that supports an unhealthy joint. Thanks again, Dr. Jen and Dr. Jason, for bringing me into your Stat Chat. If you have any specific questions for me, you can put them in the comments below, or you can reach out to me on LinkedIn.
Okay, well, I guess right there, that is why we do a stat chat.
That was awesome. Love it.
Yeah, it helps. There's a lot of nuances to these older pets and managing these issues that they have. And it's also, I think, very helpful to help manage those expectations for owners that this didn't happen overnight.
Right.
And we're not going to fix it.
There's no magic pill.
No, there's no magic pill.
Can't wait for there to be one, but there ain't one right now.
I know. Is that what you're working on?
Yes.
In the basement?
It's a big secret. It's a big secret,
That's
folks.
right. Well, at least this dog will get some relief and has a long-term plan for how to get a little healthier and live a little happier.
Be more labby.
Be more of a lab.
Yeah.
I love it.
Sure.
I love it. All right, so we hope that you enjoyed this case and learned a little bit of something new, maybe a pearl or two. And I'm Dr. Jen.
And I'm Dr. Jason.
And this has been an episode of Vet Candy's
Rapid Rounds.